Qnasl Hfa Aerosol is a medication used to treat seasonal and year-round allergy symptoms such as stuffy/runny nose, itching, and sneezing. It can also help to reduce other symptoms of seasonal allergies such as red, itchy, and watery eyes. This medication belongs to a class of drugs known as corticosteroids, and it works by reducing swelling, inflammation, in the nasal passages. The recommended dosage of Qnasl Hfa Aerosol is usually 1 spray in each nostril once a day. It is best to take this medication at the same time every day for the best results. It's important to follow the instructions provided by your healthcare provider for the most effective use of this medication. Before using Qnasl Hfa Aerosol, make sure to read the patient information leaflet provided by your pharmacist or doctor. This medication is usually used in the nose once a day. Do not spray it in your eyes or mouth. If a child is using this medication, make sure a responsible adult supervises and helps the child use it properly. Before using the medication, gently blow your nose. Follow the instructions on how to prime the inhaler properly if it's your first time using it or if you haven't used it for more than 7 days. The dosage of Qnasl Hfa Aerosol is based on your age, medical condition, and response to treatment. Do not increase your dose or use it more often than directed, as this may increase the risk of side effects. It's important to note that this medication does not work right away. Some people may feel it working within several days, but it may take up to 2 weeks to get the full benefit of the drug. It's best to use the medication at the same time each day to help you remember. Make sure to wipe the inhaler regularly with a clean, dry tissue or cloth and keep track of the number of sprays used from the container. When you have used the specified number of sprays, discard the container. If your condition does not improve or worsens, be sure to inform your doctor. Some common side effects of Qnasl Hfa Aerosol may include mild nosebleeds, nasal dryness/irritation, and an unpleasant taste or smell. If these effects persist or worsen, it's important to inform your doctor or pharmacist promptly. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential risks of side effects. Many people who use this medication do not experience serious side effects. However, it's crucial to inform your doctor immediately if you experience any serious side effects, such as pain or sores in the nose, loss of taste or smell, or signs of infection like a persistent sore throat, white patches in your nose or throat, fever, or chills. In rare cases, corticosteroids given in the nose can be absorbed into the bloodstream, leading to potential side effects. These are more likely to occur in children and individuals who use this medication for an extended period and in high doses. Contact your doctor right away if you experience unusual or extreme tiredness, weight loss, headaches, swelling in the ankles or feet, increased thirst or urination, or vision problems. Although a serious allergic reaction to this drug is rare, it's important to seek medical help immediately if you notice any symptoms of a serious allergic reaction, including rash, itching or swelling, especially of the face, tongue, or throat, severe dizziness, or difficulty breathing. This is not an exhaustive list of potential side effects, so if you notice any other effects not mentioned here, be sure to contact your doctor or pharmacist. Before using Qnasl Hfa Aerosol, it's important to inform your doctor or pharmacist if you have any allergies or if you've had recent nose problems or certain eye issues. It's also essential to let them know if you've had any infections or if you've been exposed to any contagious illnesses. Additionally, it's crucial to inform your doctor if you're pregnant or breastfeeding. When using this medication, it's important to stay away from individuals who have infections that can easily spread. Also, long-term use of corticosteroid medications can make it more difficult for your body to respond to physical stress, so it's important to inform your doctor before any surgery or emergency treatment. For children using this medication, it's important to have regular checkups with the doctor to monitor their growth. During pregnancy, this medication should only be used when clearly needed, and it's important to discuss the risks and benefits with your doctor. Additionally, it's important to consult your doctor before using this medication while breastfeeding. When using Qnasl Hfa Aerosol, it's important to be aware of potential drug interactions. These interactions can affect how your medications work and may increase your risk for serious side effects. To minimize the risk, keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. It's crucial to consult with your doctor before starting, stopping, or changing the dosage of any medicines. This will help ensure the safe and effective use of Qnasl Hfa Aerosol. If someone has taken too much Qnasl Hfa Aerosol and is experiencing severe symptoms like fainting or difficulty breathing, it is crucial to seek immediate medical help. In the U.S., residents can call their local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center for assistance. It's important not to share this medication with others. If you use Qnasl Hfa Aerosol for an extended period, your doctor may want to conduct lab or medical tests, such as nose exams or height measurements for children. Be sure to keep all your medical and lab appointments, and consult your doctor for more details. Additionally, ask your doctor for advice on reducing your exposure to substances like pollen, pet dander, dust mites, mold, and smoke, which can make your allergy symptoms worse. If you forget to take a dose of Qnasl Hfa Aerosol, take it as soon as you remember. But if it's close to the time of your next dose, just skip the missed one. Take the next dose at your usual time. Don't take a double dose to make up for the missed one. When storing Qnasl Hfa Aerosol, make sure to keep the cap on and store it at room temperature away from heat or open flame. It's important not to store it in the bathroom and to keep it out of reach of children and pets. When it comes to disposing of this medication, do not flush it down the toilet or pour it into a drain unless specifically instructed to do so. Make sure to properly discard the product and it is expired or no longer needed, and you can consult your pharmacist or local waste disposal company for guidance on how to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.